Hello, I'm Dr. Yu. Today I'm here to talk about novel antipsychotic and the treatment of schizophrenia and related psychosis. And this presentation will see the biochemical basis of schizophrenia and the mechanism of action, how these novel antipsychotic work. If you see the biochemical basis of schizophrenia, we know that the dopamine is established biochemical disturbance in schizophrenia, and especially the dopamine on D2 receptor. The dopamine, when it's increased in the mesolimbic system, this lead to positive symptoms in the form of hearing voices, seeing images, or a strange sense of smell or a strange taste in the mouth or some strange experience on the body, which we call the hallucination. When the dopamine is decreased in the mesocortical system, which lead to negative symptoms, that is loss of the ability to speak normally, that is alogia or neologism, the evolution, that is the loss of the motivation to initiate, and the related negative symptoms in the form of apathy, blunted effect are also included in this. So the dopamine is implicated in both positive and in the negative symptoms. But we know that the pathway for the positive symptom and the negative symptom is different. The mesolimbic for positive symptoms, the mesocortical is for negative symptoms. So the conventional antipsychotic like alloperidol, tribulopyrazine, and the other related first generation antipsychotics are dopamine antagonists. So what they do, they decrease the level of dopamine in the mesolimbic system, but that's good to give the coverage for positive symptom. While these antipsychotic further decrease the level of dopamine in the mesocortical system, which is already decreased. So it's possible by treating positive symptoms with conventional antipsychotic, the negative symptom might start appearing. So this is one of drawback with the conventional antipsychotic. There are some newer antipsychotic which are called non-D2 receptor antipsychotic. This include cariprazine. They exert more effect on D3 receptor and also on the serotonin receptor. The brexpiprazole, which act on D2 receptor as well as on some other receptor which are called SERT receptor, and lumateperone, which act on D1 receptor, and this also act on some other receptor. So these are called non-D2 receptor. So these drugs not only act on the dopamine receptor, but their site of action is different than the typical antipsychotic, that is D2. So this brings some advantages. We'll discuss some of the advantages later in this presentation. As we mentioned that the conventional antipsychotic cover the positive symptom, but the non-D2 receptor also give coverage for the negative symptoms. So it's very important that we should treat the positive symptom as well as negative symptom, because 60% patient with schizophrenia has negative symptoms. In this regard, there's a very interesting drug that is called aripiprazole. Aripiprazole is interesting in a sense. It acts as a antagonist where the dopamine is high That means it acts as an antagonist in the mesolimbic system, while it acts as an agonist where the dopamine is low. That means it acts as an agonist in the mesocortical symptom. So the aripiprazole give coverage for both positive and negative symptoms. This phenomena is called Goldilocks phenomena. This this is some of the novel mechanism of action by aripiprazole. We also know that other than dopamine, the serotonin is also implicated in schizophrenia. The serotonin is decreased, especially in the prefrontal cortex. The most of the second generation antipsychotic act on these serotonin receptor and that brings some of the coverage for the negative symptom as well. There's a new drug which is approved by FDA for the Parkinson related psychosis is Permabenchy. This drug acts on the 5-HT2A receptor. Sometimes is a agonist, sometimes is an antagonist. Therefore, it's called inverse agonist antagonist on serotonin receptor. The glutamate is also implicated in schizophrenia. Normally, the glutamate brings a balance of excitation and inhibition on the cortex. But in schizophrenia patient, this balance is lost. So this is proven by those patients who use pencyclidine and ketamine. They bring symptoms like schizophrenia. These are NMDA receptor antagonist. There's some new drug like D-serine, which is NMDA receptor agonist. This is trialed in as a add-on therapy for schizophrenia patients who are on clozapine. This actually improved the psychosis as well as negative symptoms. The other glutamate modulator that is the lumateperone, which we discussed, also act on the one receptor, is a newer drug. This is approved in 2019 by FDA for schizophrenia. The efficacy of lumateperone is that equal to the risperidone, but the as we know this is targeting the other neurotransmitter like glutamate. This makes this drug free from akathisia causing symptoms. So this is drug of choice nowadays for those patients who are prone to akathisia. Other than that, the GABA and acetylcholine, which are responsible for the cognitive symptom, there are some newer antipsychotic which are targeting these receptors. In this regard, there's a drug which is called Xenomelene, which acts on the M1 and M4 receptor as a agonist. It's under trial. It improved the cognitive symptoms and psychosis in patients with schizophrenia. The other drug include the TAR1 agonist that act on the receptor of triamine associated receptor, which actually improve the schizophrenia by indirectly modulating the dopamine level. The future targets include these are some of the drugs and receptor which are under trial. This includes the roluperidone, which act on the sigma-2 receptor, the TAR1 agonist. We discussed the some of the other drugs which are in trial are targeting on the nicotinic receptor. Thank you for listening. I hope this remained useful and helpful. If there's any question, kindly feel free to ask.